Welcome to the webinar this afternoon, Pulmonary Fibrosis during COVID-19, What Patients Need to Know and How to Cope. We would like to thank and acknowledge the sponsor, Boehringer Ingelheim today, who kindly supported this important webinar. So thanks everyone for joining. So we're just into the welcome introductions, and there's a few housekeeping items to share with you. We will then kindly get into our presentations with our esteemed presenters, and we'll save lots of time for Q&A today. We've got about 20 minutes. Thank you to those of you who have submitted your questions in advance. We will do our best to get through as many questions as we can, and we're hoping to wrap up just after 2. So it's with great pleasure that I introduce our faculty this afternoon. We've got 2 esteemed respirologists from across Canada, Dr. Shane Shapira, who's an assistant professor and faculty of medicine in the Division of Respirology at the University of Toronto, and is also the director of the ILD program at the Toronto General Hospital and University Health Network. And Dr. Shapira is also the director of the Interstitial Lung Disease Fellowship Program at U of T. Would also, from out west, like to equally welcome Dr. Meena Kalluri, who's the Associate Professor, Faculty of Medicine and Dentistry at University of Alberta, and is also the Director of the Multidisciplinary Collaborative ILD Clinic, the K Edmonton Clinic at the Alberta Health Services in Edmonton. So welcome, Dr. Kalluri. And would also like to welcome Sharon Lee, who is the Executive Director at the Canadian Pulmonary Fibrosis Foundation, and that organization is the organization that is hosting and supporting this initiative today. So welcome, Sharon. Okay, so just a few housekeeping items for everyone. Please note your participants' audio is muted, and we do this just to ensure that everyone can hear the presenters clearly. If you do have any questions, there's a Q&A feature that is enabled. Please type in your questions. Again, we will do our best to answer as many questions as possible, and we'll likely do a mix of those that had come in advance of the webinar, as well as those that come in during the webinar. If for any reason you're having significant technical issues, please send me an email, or even better, shoot me a text, and I will do my best to try to support you and get you up and running. Okay, so Sharon, before we move on, would you like to say any words before we pass it over to Dr. Shapira and Dr. Kalluri?
I just want to thank everyone for joining us today. And again, I want to express and echo my thanks to Dr. Shane Shapira, Dr. Meena Kalluri, and of course to Boehringer Ingelheim Canada for supporting this event. Thank you very much.
Well, thank you to Sharon and the CPFF for inviting me and Dr. Kalluri to talk today. I have to be honest, there is no place I would rather be than inside on a snowy day in May talking about a global pandemic that is wreaking havoc across the world. So it is a real pleasure. So as I open up, as Dr. Kalluri and I were talking about what we wanted to talk about today, it became really clear that before we get started, we have to be very clear with the audience about what is it that we know and what is it that we don't know. And so we're going to try and answer as many questions as we can, but it's important to know that you're used to doctors telling you the facts and telling you the truth. But there are so many unknowns with COVID-19, and these are not just unknowns for patients, but also unknowns for their doctors. So we're trying to learn the information as fast as we can, but we're all learning at the same time. And so what I get asked a lot is, what's the right thing to do? What's the right thing to do for me, the right thing to do for my family? And I want to be really clear that both Dr. Kalluri and I today are going to be able to give you some advice, some suggestions. But the whole point is that when we live in these uncertain times, the right thing to do is really a balance of the risks and benefits. And every person and family has to decide for themselves how they're going to live in this new world. I've got a list of links here today, and we're going to talk about several of these websites. I want to let you all know you don't have to write any of them down. At the end of the presentation, we will have all the links available to you, and that's going to go up on the CPFF website, so you can follow some of these links later. So as we get started, I think I spend the first couple of minutes giving you a quick blow-by Epidemiology 101 so that we can all make sure we're on the same page. So the first thing is to define some terms. So what is a coronavirus? So a coronavirus is a family of viruses, and this family causes a wide range of illnesses in humans. Anything from the common cold to this group of viruses called beta coronaviruses. Oh, I'm getting a bit of an echo. Is that all right on your guys' end? Oh, it's gone. Coronaviruses can do anything from a common cold to this group of viruses called beta coronaviruses that cause much more severe disease. So SARS is an example of a beta coronavirus, MERS is another one, and now this new one called SARS-CoV-2. It's the SARS type coronavirus number 2. It's like the sequel. And SARS-CoV-2 is the official name of the coronavirus that is causing the current pandemic. The third term I want to define is COVID-19. So when we talk about COVID-19, what we're actually talking about is the specific disease caused by the SARS-CoV-2 virus. Just 3 more terms I think we should all be familiar with. The first term is endemic. So what does it mean if something is endemic? So something is endemic if it's an infection that's localized to a specific area with very stable rates over time. So examples of endemic things are malaria in certain parts of Africa. And even the flu, which spikes up and down, it tends to do that in a really reliable way. And so that's an endemic infection. An epidemic is when one of these localized endemic infections has a sudden rise in their rates. So we hear this all the time about measles outbreaks at Disneyland or polio outbreaks in certain parts of the world that aren't able to vaccinate because of wars and other things. A pandemic is when one of these epidemics spreads throughout a region or across the world. And so examples of pandemics are the Spanish flu, H1N1, and COVID-19. But it's important to remember that not every pandemic has to be deadly. So H1N1, for example, obviously some people did get sick and there were even some people who died from it. But generally, we don't think of H1N1 as causing massive illness and death, whereas COVID-19 is really a completely different beast. The last part of my Epidemiology 101 is to teach you a little bit about how our bodies respond to these viral infections. There are 2 different parts of our immune system, and they do very different things when we get infected with a virus. The first part is our innate immunity. And so your innate immunity is the part of your immune system that starts to fight the virus right from day 1. This part is not specific, so we have the same innate immune response to all different kinds of infections. Kind of think of this as like a machine gun that's just spraying bullets all over the place. Our innate immunity is supposed to try and control the virus long enough for the specialized sniper rifles to get developed. And that's called the adaptive immunity. The adaptive immunity takes time for it to develop, and that part of our immune system is very targeted specifically at the virus. This is when we might start to make things like antibodies to try and attack the virus specifically. And the only way we're really able to control an infection is when we have a little bit of both. So at the beginning, the virus infection will increase. The innate immune system tries to keep it under check but can't get rid of it. It's not until you get both parts of the immune system attacking the virus that it gets under control. The problem is that for some reason, in fact, for reasons we don't entirely understand, sometimes this innate immune system can just go wild. So certain infections will cause our innate immunity to start not just spraying machine gun bullets, but suddenly doing cannonballs all over the place. And when this happens, we call it a cytokine storm. And that's when our immune system starts to make all of these chemicals that are intended to fight the virus. But instead, what they do is they start to damage everything, and they can start to damage all of our organs, like our heart, our liver, our brain. All different parts of the body can be affected during this cytokine storm and get accidentally damaged like a bystander. Now, COVID-19, for reasons, again, that we don't entirely understand, seems to cause a lot more of this cytokine storm. That generally happens somewhere around day 5 to 10, after the infection should just be going downhill in the sense that we should be getting better. Instead, the infection seems to rev up right around day 5 to 10. Many of us have seen that as this day 5 to day 10 comes around, suddenly people get really sick. And the classic example of that many of you will have seen on the news is Boris Johnson. When Boris Johnson, the Prime Minister of the UK, got the virus, it wasn't until about 7 days later that he actually got admitted into the ICU, or the intensive care unit, because that's when he started to have this cytokine storm. There are 2 different ways that we can test for COVID-19. The main way that we test for this infection is using a swab test. And so this picture on the top right shows how we do the swab test. The swab is placed into the nose, and it's got to go all the way to the back. We kind of joke that if you don't feel like it's tickling your brain, it probably wasn't done right. That will detect the RNA from the virus, and it can tell you if you have an active infection right now. So it's very useful for the diagnosis. And this is the test that we're talking about when you keep hearing on the news every morning how many tests have been done and how many people have tested positive. Another kind of test is a blood test, or serologic testing. And these blood tests look for these antibodies. So now that you've seen my description of what happens with the virus, this is looking at the adaptive immunity, that later part of your response. The advantage of blood tests is that it tells you if you've had the disease in the past, but it's not very good to let you know if you've got the infection right now. We hope that by checking for these antibodies, we can determine if people are immune to the virus. But we're really not sure if those antibodies, A, give you immunity, and B, if you are immune, we're not sure for how long. A great example is the coronavirus that causes the common cold. We all know that if a cold virus runs through your house, everyone might catch it, and then a few weeks later, you all get better. You don't keep on circling it around yourselves because eventually you become immune. And yet, with the common cold, once again, you'll know that a couple months later, if someone else brings in that same coronavirus with a common cold again, you can all get affected again. So we don't know how long we are immune. These antibody tests are not yet available in Canada, but they are being developed, and it's hoped that these will be helpful to give us some idea of that immune status. The next thing I'm going to talk about is masks. So there's a lot of talk about masks on the news, in the papers. And there's 2 different kind of masks that you should be familiar with. The first kind of mask is called the surgical mask. These masks protect others from the wearer. They only really provide marginal protection to the person who's actually wearing them. They can be made at home or they can be purchased. And they're generally worn by frontline workers. And it's thought that eventually they'll probably be worn by all people leaving their homes until the pandemic is over. In fact, the CDC in the United States just made a recommendation last week that they're recommending that everybody in the United States who leaves their home should be wearing a surgical mask. The other kind of mask to know about is an N95 mask. So these masks protect healthcare workers from infected patients. They're very tight-fitting. They usually have tight elastics around the back. And it's not just about the fact that they're tight. They have to be personalized in their fit. So to get an N95 mask to work, you have to sit down for a personalized fit testing where we determine which kind of N95 mask fits you. As an example, both my wife and I are frontline healthcare workers. We wear very different masks. And whereas the mask that I wear is available all over my hospital, the mask that my wife wears is actually in very short supply in her hospital, and that's a big challenge. These N95 masks are not some cure-all that everyone should wear it all the time. So patients often say to me, what if I could get my hand on an N95 mask? And my answer is, you need to leave those N95 masks for the healthcare workers that need them. Because even healthcare workers don't wear them all the time. It's only during very high-risk patient interactions where healthcare workers need to use those masks. So for example, when people are connecting patients up to a ventilator, that's the kind of time where you need to be wearing the highest protection mask, and we need to save those masks for those interactions. So where are we in the pandemic? So this is a graph that I actually took from this website today that looks at all the numbers of new cases of coronavirus infection or COVID-19 infections in Canada. You can see that we've done a pretty good job of flattening the curve. It's not going up, but it hasn't really started to go down in a major way if we look across the country. On the other hand, if we break it down by provinces, we see that this isn't really just one infection that's going across the country. It's a little pockets of infection in all different parts of the country, and each province is having a different experience. So as an example, British Columbia, which is in yellow on this graph, they never really spiked. Alberta, which is in orange on this graph, spiked, but their numbers have gone down substantially. Ontario seems to have peaked probably somewhere around the end of April. That's the blue line. And it's coming down, but you can still see there's lots of ups and downs. I didn't include Quebec in this graph because their numbers are even different. They may not have even reached their peak yet, and their numbers are much higher than the rest of the country, so they actually would go off the top of the graph. So now a couple of questions about how do you catch COVID-19, and I want to recommend that you take a look at this website. This is put on by the CDC, and this website really has dozens and dozens of questions that are answered for you. But I got a lot of my information from that website. Well, I've gotten information from lots of places, but a lot of the questions that I'm seeing come up a lot are on that website when I was reading. So the first question I get asked is, how does the virus spread? So the virus spreads by close contact. It's got to be person-to-person contact through inhalation of these respiratory droplets. And those droplets are made when an infected person coughs or sneezes. So when I say a close contact, what do I mean by that? So the CDC considers a close contact a person that you have spent more than 10 minutes with who has the infection, who was not wearing a mask, and was at a distance of less than 6 feet. I've underlined all three of those points because it's really important that you realize what a close contact is. This is not just having walked next to someone for 30 seconds who never coughed and didn't have any symptoms, where they were wearing a mask and you were wearing a mask. This is really a close contact in an enclosed space and someone who was not wearing a mask who is close to you. Then the question comes up, can you catch COVID-19 from touching contaminated surfaces? And the answer is maybe. It may be possible to become infected by touching surfaces that have been touched or come into contact with respiratory droplets from an infected person. But this is generally considered to be pretty low risk, and it is definitely not the main way that the virus is spreading. So the next question is it safe to touch my groceries or to take food into my home or take out food into my home? And although touching objects is low risk, we don't think it's zero risk. So we do recommend that, yes, you can bring groceries into your home, you can bring takeout food into your home, but after you touch those things, make sure you wash your hands with soap and water before you eat and before you touch your own face, nose, and mouth. It is important to know that there are currently no reports of transmission of COVID-19 through food. In general, we think that the food itself is not the problem. If anything, it would be the containers that's holding the food. So what can you do to protect yourself and others from COVID-19? Well, obviously you want to avoid public spaces and gatherings with other people. Well, that's not news. You've been seeing that on the TV for weeks. But I do think it is safe, even for people with underlying lung diseases like pulmonary fibrosis and other interstitial lung diseases, to go out for walks. It's important to get out and be active. If it ever stops snowing, you're going to want to maintain your physical fitness. So walking on a residential street with a housemate is safe. I do not believe that a quick pass by on the sidewalk with someone who is wearing a mask who didn't cough is likely to get you infected. In fact, even if that person did cough as you were walking by, chances are you're not going to have spent that 10 minutes at an enclosed space with them to constitute a close contact. I would encourage you to do safe excursions, so wear masks when you're leaving the house. That's not to protect you. Remember, that's to protect others from you. At the same time, you want to try and interact with frontline workers that are wearing a mask because they're doing that to protect you. When you're out of the house, I recommend that you use these alcohol-based hand sanitizers frequently. And when you get into the home after an outing, you should wash your hands. And finally, I recommend safe healthcare. So most doctors are still seeing patients, but not in person. They're seeing them by video conference. In general, what that means is that you want to try and avoid unnecessary visits to clinics and to hospitals. But some tests might still be required. Although I'm not really doing breathing tests on many of my patients, I still sometimes am doing CAT scans. I'm not doing my routine CAT scans, but if there's something that I really want to know, a CAT scan may be the only way I can get that information. And so if you've got tests scheduled with your doctor, talk to your doctor about whether or not those tests are required. On the same token, stopping and starting medications is the kind of thing you want to talk about with your doctor. We specifically do not recommend that anybody start or stop any medications without discussing it with their doctor, because the risks and benefits have to be balanced for each patient. So what about treatments? So what you keep hearing all over the place, and particularly my patients with pulmonary fibrosis, feel like there's nothing they can do about it. And so if they get sick, they're just goners and that's it. And that's really not the message. There is hope. Most people, even people with interstitial lung diseases, most of them, when they get this virus, they get better. But unfortunately, not everybody gets better. So what can we do? So we do a lot for our patients. Particularly, we do this thing called supportive care. This is where we monitor patients in hospital. We might give them IV fluids. We do some interesting things with positioning. There's some talk that having people lie on their stomach if they have the virus actually makes them do better than if they lie on their back. We can give oxygen. And for some people, we might give them machines or ventilators to help them to breathe. This stuff really works. This isn't nothing. This is real helpful. There's also drugs. The 3 drugs that you're hearing the most about on TV are this hydroxychloroquine, remdesivir, and tocilizumab. And if you ask Donald Trump, he'd be convinced that all of these drugs cure everybody, especially if he happens to have shares in that company. But at this stage, the problem is we really just don't have evidence to support any of these drugs. We're hoping that'll come, but at the moment, we don't think that there's any evidence that definitively shows that these drugs work. And it is really important to know that we do not think that these drugs are particularly helpful for people with ILD and fibrosis. We just don't know if they work or not. There's also this idea of using blood plasma from recovered patients. The idea is you take the blood of someone who's had the infection and survived it, and you give that to other patients. And the hope is that you can borrow that adaptive immunity, those antibodies in that second part of the immune system, and that might make people get better faster. But we have no idea if that works yet. But there are studies of all of these things going on, good quality randomized trials. Hopefully we'll get the answers in the next couple of months. Just to finish off my part before I hand over to Dr. Kalluri, we have written, a group of us in Canada have gotten together and written a paper about the practical considerations for the diagnosis and treatment of fibrotic interstitial lung disease during the COVID-19 pandemic. This is meant to be a resource for physicians, but it is freely available for anyone to read. And if people do want to look at what the doctors are writing to each other about how to manage these diseases in the time of COVID-19, you're free to read them and go through it, because I think a lot of it would just echo what I've said today. With that, I'm going to hand over to Dr. Kalluri.
Hello, everyone. And I just want to thank Shane for that beautiful introduction. And I thought the next few minutes, I'm going to spend some time talking about the human toll of this complicated situation that we find ourselves in. I don't think we have to go too far to appreciate things that are coming up as a result of the current situation, whether it's anxiety from health-related issues or social circumstances, losing your job, losing your business, what have you. So this word cloud, I think, very nicely captures a lot of different spectrum of emotions that people are undergoing at this time. And what I would like to highlight is that on this token, we also have beautiful examples of things like kindness and hope and love and the community coming together. Just in our own neck of the woods here in Alberta, we had the Fort McMurray floods. And I was just amazed to see how the community came together, how the businesses came together to replenish our food banks and to support people in this time of need. So I guess what I'm trying to say is that no matter what situation you find yourselves in life, whether it's pandemic related, whether it's something else, shortage of organs, shortage of drugs, shortage of healthcare, other issues. There's always two different perspectives to any story. And a lot of our emotions are driven by what perspective we choose at any given point in time. And I find personally, at least in these times, I found that going back to that idea that you still have that control, you still have that ability to choose that perspective is extremely empowering. And I find that whenever we sit together, well, not in these times, but at least when we're on Zoom conference calls or when we're on with patients on the phone line, I find that very, very empowering just to recognize that within myself and to remind my patients that, you know what, no matter what situation you find yourselves in, there is something that you can always choose, and that'll be your perspective. And one of the most profound statements, that I came across in the last little bit was someone saying that there is just one earth, right? There's just this earth where we are all experiencing different things with different situations in life, but there are billions and billions of worlds. Which means what? Which means that every single person has a unique perspective, and what we experience through that perspective is an individual world. So while the planet is the same, we have different worlds on it. So I find that very, very useful in these times, just to remember that perspective is really important, and we need to make sure that we keep the right one for ourselves. So with that in mind, I thought about the one person who could talk to us about social isolation, and who better than an astronaut? I'm sure you've seen this gentleman on the TV screen or perhaps live at some point. This is Chris Hadfield. He's a celebrated Canadian astronaut. And these are the guys who have spent weeks, if not months, in space in isolation. So who better to talk to us about what that feels like and how do you cope living with those inordinate circumstances, in those circumstances. So when he was asked on how to cope with fear, this is what he said, and I thought I'd share this with you today. He says, Chris Hadfield says, for me, the absolute key is to separate danger and fear, because they're not synonymous. They're not the same thing. Danger is understandable. It's comprehensible. It's being dealt with, and the authorities are striving to come up with all of the different types of scientific and societal interventions to decrease the danger. That's all being done. But at an individual level, I think you really owe it to yourself to not just get overwhelmed by all the noise. And I find that this is something that comes up often as we try and navigate this situation for ourselves, with our friends, with our families, and in particular with our patients. Because like Shane said in the very beginning of this talk, right, there are few facts and there are a lot of questions, which I hope we'll have answers to in the next foreseeable future, but we don't. So this is something that we all have to learn how to deal with. That's uncertainty. So as far as COVID and mental health is concerned, I think there's been a lot said about this, whether it's in magazines or write-ups or television interviews, that the fear that's surrounding this whole process, we know that it can lead to stress. We know that it can lead to hopelessness and despair and anxiety and depression. It can trigger all of those latent tendencies. And sometimes when you already have those diagnoses, it has the potentiality to make it worse. So it is counterproductive to all of our patients. And not just our patients, I would say that it is counterproductive to anyone else. Why is that? Because we know that these kinds of mental states and mental situations can worsen symptoms. And the most common symptoms of PF, and not just PF, but in fact, any lung disease includes breathing problems, not being able to catch your breath or feeling like you can't take a big enough breath, cough, chest pain, just generalized tiredness or fatigue, what have you. And why is that? So if you look at that diagram, right, it starts at the very top where it says you become stressed. Doesn't matter what the trigger is, shortness of breath begins. And it's easy to understand that. You can imagine, close your eyes and imagine what a stressed person looks like. And you can see they're starting to hyperventilate, the breath becomes really short, and even there's breath holding at times. So this is very important. So stress starts to trigger certain areas in your brain. And those are the areas in your brain which control breathing, which control your heart rate. And this is why your body begins to respond with breathlessness. And the breathlessness triggers more anxiety. And then the anxiety makes your breathing faster. The muscles start to get tired, which makes the shortness of breath worse. And you can see this whole cycle begins to evolve or devolve into a massive, massive panic attack. I cannot begin to describe the number of times I've seen patients in these crisis situations where they end up calling 911 or presenting to the hospital. And I think this is particularly important for all of us to understand and appreciate in these times, because I know there's a lot of fear around, wanting to go and see your doctors urgently or going to the hospital. And a lot of my patients don't want to do that. So I think it's very important to understand how the stress and anxiety and sometimes even an overwhelming emotional reaction can trigger a lot of worsening of symptoms, which is not necessarily the disease, but it's actually all of these other things. And I think as we become more and more informed, more and more aware, it's possible to maybe control it to a certain extent so that it doesn't degenerate into a panic and then lead you to a hospital, because those things are completely avoidable. So I think this is why it's really important to understand how these mental situations, mental states, and sometimes our own reactions to these states can affect symptoms. So what else can this stress and fear do? Well, easy to understand. We know there's a strong relationship between breathing, stress, and blood pressure. It can worsen your diabetes, which means your sugars, blood sugar control can get worsened during stress. It can worsen your heart disease. We talked about depression and anxiety. The other big thing that it can disrupt is your sleep. So a lot of people are waking up, they talk about they can fall asleep, but they are not able to stay asleep very well. Or their sleep is disrupted. They wake up at 3 a.m. and 4 a.m. because they have these recurring nightmares and they can't sleep. They're worried. They're just revved up all the time. And a lot of fear and stress and anxiety is what drives some of those things. And of course, all of these things eventually will make your quality of life worse. So this is why it's important to understand this link between how these actual physical worldly situations affect your thinking, and then the thinking affects your emotions, and the emotions can affect your breathing and your symptoms. So what's the solution? We know that this is not avoidable. In fact, fear, I think, is a very normal human reaction. It's part of human experience. If we didn't have fear, I think we would have evolutionarily lost a lot of our capabilities, because fear is also protective. Because when you're afraid of something, then you're going to think about it, perhaps not do it. And that's what saves you from real danger or grave danger. So this is why it's important to recognize that the fear can also be healthy. But when the fear begins to drive all of your emotions and your physical reality, then that's when it becomes paralyzing. So we have to understand that while it's unavoidable, we can learn how to live with it, and we need to adapt. And that's where building resilience comes in. So I pulled this roadmap from the American Psychological Association. And those of you who are interested, I would recommend that you access their website. The address is located below on the slide. And they talk about a really beautiful roadmap on how to build resilience, not just for this situation, but I think it applies for any crisis that you're going through. And it starts out with really recognizing your sources of support and building those connections so that they're there to buttress you, fostering wellness, finding purpose and meaning in whatever your situation is and whatever it is that you can do. And finally, beginning to understand that issue about perspective we talked about in the beginning, that you always have a choice to choose the perspective that you want to hold. So you can make the choice to embrace something that's healthy, something that's constructive for you. And of course, to remember there's no shame in asking for help. And that help can come from your family doctors. It can come from your ILD team. It can be accessed through psychologists and psychiatrists. And in fact, I wanted to point out that there's a very, very nice web resource that our federal government has developed, and you can access it through the Public Health Canada website. I think it's called Wellness Together. And they have self-assessments that you can take. They have courses that you can take. They have group sessions. If you so find yourself in a position that you want to chat with somebody privately, you can text wellness. There's a number. It's all on the website, and I'll leave that information at the end of the slide deck for you. So that's a very, very useful resource, something that you can access while you're sitting here at home. You don't need to step outside or contact anybody else. So let's talk about building connections. Now, even before COVID came on, we have recognized in medical science through research that social isolation is quite deadly. In addition to the disease, it can actually affect your health and your longevity. So it's very important to make sure that we're never socially isolated. And so while we remember that physical distancing rules must be respected because we all want to contribute to containing this disease, it doesn't have to mean social isolation. Physical distancing is not social isolation. And we must all do our bits to try and make sure that those two don't coincide. And how do you do that? So in this current circumstances, I think the best way to go about doing that is to try and organize virtual meetings, a scheduled check-in, make that into a routine. I'm sure you've heard it often, but I want to persevere and repeat it again. I think it's very, very important to maintain a routine. So whether you do it once a day, once in a few days, once a week, it's very, very important to have these scheduled audio video check-ins with whoever you think is the best support for you. I know a lot of my patients are also connecting with faith-based groups, local community groups. This is where support groups, particularly through CPFF or your own local PF groups, are very, very important, so that if you feel the need to reach out, if you just feel the need to share your emotions, your current situation with somebody, you have a ear, a shoulder to lean on, even if virtually. Participating in online activities is really nice. I'm sure you all have heard about these virtual get-togethers where people are sitting together, having their coffee, sharing their favorite poetry, something that they've read, something that they want other people to listen to, a favorite piece of music, so on and so forth. So there's a lot of different ways to get creative and to try and participate with people actively. So the next thing, fostering wellness. And remember, wellness is not just physical, because health is not just absence of disease, but it's also wellness in the physical, mental, emotional, and spiritual realm. So I can't speak enough, but regular exercise is really important. And whether you want to do something more formal or just to go out for a walk, doing some light stretches, even yoga, like things like chair yoga. If you've never done that before, it's certainly something that a lot of my patients have tried, and they highly recommend that. I left a link to an exercise video that's also accessible through the CPFF website. That's something that you can follow. There are some online rehab programs, because right now most communities have shut down their community programs, so online programs might be beneficial. Healthy diet and good sleep are paramount. Now, how do you do the mental, emotional side of wellness? I found that a lot of my patients find deep breathing exercises really useful. And I know there were some people questioning about the utility of that and how to do it and so on and so forth. So there's a lot of different resources. Most of them have been developed for COPD, but some of them are actually helpful when you use diaphragmatic breathing or abdominal breathing or belly breathing. All of those exercises are tremendously useful, particularly because I find that breathing exercises are very grounding. So if you find yourself in a situation where you're fraught with anxiety, tension, worry, you can't sleep, when you bring your awareness to your breathing, it immediately starts to calm yourself down. It brings your heart rate down. It brings your breathing rate down, so you're able to relax and refocus your attention. And of course, staying informed is really, really critical, and making sure that you're using reliable sources, whether you're using the Public Health of Canada website or CDC, it's really important. But also remember, you have to do that in moderation. It's very easy these days to get hooked onto these news channels and getting constant updates. So I've recommended to a lot of my patients to do digital detox every day, whether it's an hour, 2 hours, 3 hours, 4 hours. Have a set period of time where you're completely disconnected from your devices and giving yourself that time and space to recuperate, because it can get really toxic. And I won't belabor the last point, but again, connecting with people and finding that source of support is really important to maintain your emotional and spiritual health. Finally, finding purpose and embracing healthy thoughts starts out with setting something realistic, like finding a routine, making a routine. You can undertake creative projects. I know several of my patients who've taken up sewing. Some people have taken up crafting. Some people have started to go through their old photo albums and try to recreate those in a newer version, a digital version. So there are a lot of different things that you can still do at home to keep yourself focused, building the aptitude for forgiveness, self-compassion, and smiling more. And this came about recently, as people started to say, touch is such a foundational emotional gesture, and you can't do that anymore. So how do you really connect with people? So I find that, smiling is another way that you can. You don't have to touch people that way. You're practicing your distancing, and smiles are contagious. So practice that more. have a sense of gratitude, an attitude of gratitude, and smiling more, I find, is really, really grounding and really channels all that positive energy inside you when you start your day. Maintaining hope is really important. I know it's hard, but this is why I think making that a routine and thinking about that consciously really helps. It's like a muscle. You have to work at it to develop it. And why is all this so important? Goes back to that diagram that I shared with you. Because how you think affects how you feel. And how you feel affects your breathing. So ultimately, it comes down to not having a crisis with breathing, because then that's where problems start to occur with pulmonary fibrosis or any lung disease for that matter. So I think this is why it's really important to understand that the role or the relationship between cognition, emotion, and physical symptoms is very well known. And I just left this graph out, this table for you. It describes the various emotional states, and then it compares those emotional states to the breathing rate and the breathing depth. And as you can see, things like anger and fear, they change the rate, they make them faster, and people are sometimes breathing shallower with it. So you can see how these kinds of situations can precipitate problems with breathing. And finally, I want to leave you with some practical suggestions on what you can do, because I think when you start to focus on perspectives that you can change, on practical things that you can do, that is really empowering. So let's talk about that. I'm sure you've already been through so many weeks of this pandemic situation. If you've not already learned this, you probably are an expert by now. Making sure you have enough medication supplies, calling your physicians early for any kind of refills. You probably already know that lots of different pharmacies are doing deliveries, so try and depend on that. Blood work always comes up. You have these routine blood work for a lot of these different medications. Now, some of them we can safely postpone a little bit, and others not so much. So this is why it's really important to have a frank discussion with your doctor and try to assess the situation in your own local communities. Another big thing that comes up, or something that I've learned recently, are a lot of my patients who are on oxygen. They need to have their lifeline checked, right? Make sure that you have access to your supply company's number. They generally are very good at being there 24/7, even at night or weekends. We're trying to make sure that you have adequate tanks, you have the right kind of oxygen tubing, right kind of concentrator if you're on it. We also had this come up recently with one of our patients where there was a power failure. And because of the current situation, they had to wait a little bit longer for the power to be restored. So if you ever, God forbid, find yourself in a situation like that, if you have some extra cylinders of oxygen, then it could be life-saving. And I put that last bullet in there about paying attention to nasal lubrication, because this is something that I also learned while being on call. One of our fibrosis patients got admitted simply because they were on high flow oxygen and didn't know enough about having enough supplies to take care of the nose. Many of you who are on oxygen know this, though. Oxygen can be really, really drying, right? So when you don't use these lubrication products, then your nose can get congested and stuffy and you can't breathe. And then those are some of the COVID symptoms. So it becomes very confusing. So this is why it's very important to make sure that if you have chronic sinusitis, if you have oxygen, that you understand how to treat those symptoms and you avoid getting into crisis because of them. Some other practical considerations, I think we talked about it, so I'm not going to get too much into it, but again, there's no substitute whatsoever for physical activity. Even if, like I said, even if it's some light stretches and walking, please, please, please try and do that, because physical activity will have a long and very deep impact on your mental and emotional health. And we talked about diet, but with reference to our fibrosis patients, it's particularly important that you don't gain unhealthy weight, and especially if you're waiting on a lung transplant list, it's very important to make good choices while you're stuck indoors at home, where a lot of people are reaching for food as comfort. So be very mindful of that. And same thing, substance abuse also tends to go up when people are going through a lot of stress or cooped up inside their house. So please watch out for your alcohol intake. A lot of our medications that we use to treat fibrosis, or sometimes the immunosuppressive medications, they all work or get metabolized or get processed in your body in the liver. And when you drink or you consume a lot of alcohol, it starts to affect the liver. So it's very, very important to make sure that we're not overindulging in any of those things. And of course, we are all here, even though the in-person clinics are not. I have made myself available through Zoom conference calls, through telephone. So if you ever feel the need, please reach out to your ILD clinic and your team, because they're here and they want to help you. And finally, have this action plan, because like I said, having an action plan, having things to do is always empowering. So what does an action plan really mean? It's basically nothing than, do I know what I would do in these situations? Do I know where should I go and who should I call? So that's basically an action plan. This is an example of what I call a symptom management action plan. So lots of patients have shortness of breath or dyspnea, and this is an acronym, okay? The acronym is COMFORT. First, calling for help, observing to see how to respond. If you have medications that your doctor is giving you for the shortness of breath, most of them are like opiates or morphine-like. Use of a fan is good as long as you're just indoors and at home. Most acute care institutions will not allow that. Make sure you have enough oxygen, providing reassurance, and timing these interventions. So this is a nice little acronym for those of you who are looking for an action plan. We talked about oxygen, who I call. So I've always asked my patients to keep a list of contact numbers, whether it's their doctors or home care staff or pharmacists or oxygen providers, keep it handy. And if you're in trouble, where do you go? So typically each province will have their own system of how this is worked out. We have a different system in Alberta. So I'm sure wherever you are at, you should probably have a little action plan, knowing if things were to get worse, who do you call and where do you go? And this is another thing that I learned recently from being on call. Several of my patients who got admitted to the hospital couldn't have their family members bring things back in for them. So this was something that I learned from patients, and they said that some of them forgot their cell phone or they forgot their chargers, didn't have their toiletries. So just in case, hoping that you never ever have to use this, it's good to be prepared just in case you have symptoms or you develop some shortness of breath and you end up going to the hospital, that this is all available for you. And just remember that visitation is not really allowed, and it becomes really difficult and challenging for families and patients. So I thought I'd share this practical experience that we had in the last few call weeks. And the final point there is advanced directives or goals of care. So if you have it, it's always good to take it in with you, no matter where you go, whether it's to a hospital or urgent care or to your clinics. So I just wanted to end with COVID-19 and palliative care. There's been a lot of talk about this, at least on the medical side of things. I don't know how much has trickled into the general public discourse. The reason why this is important is because we all know that not all COVID-19 infections are serious. Thankfully, 80 to 85% of those patients will recover and will not have a lot of problems from it. But there is a small percentage of patients that get really sick. And those are the people that we worry about the most, because those are the people who end up needing these higher resources, like going to the ICU, being on a ventilator. And a lot of them don't make it when they get that sick. And why is this important for PF? Because even before COVID, we knew that our pulmonary fibrosis patients, for whatever reason, whether it's infection or a non-infectious exacerbation, if they ended up being on mechanical ventilation, on those breathing machines and tubes in the ICU, their chances of making it out are quite slim. This is why we always prefer that these patients, if they're transplant patients, get worked up early. And if not, then we need to have that discussion, because a lot of patients, once they know those odds, they don't prefer to be alone and die in the ICU in that fashion. So this is where it becomes really helpful to have these conversations in advance when you're not in a crisis, where you can think, sit down, go back and forth, discuss this with your family, discuss this with your medical care team, to make sure that you're getting the care that's best suited to you, that is in alignment with what you think is right for you. So this is something that I always recommend, and we try and do this with all of our patients in a non-crisis situation. And then, of course, if you have COVID-19, unfortunately, you're in the hospital and you have these worsening symptoms, palliative care is really there to help improve your symptoms while hopefully you still recover from the infection and you can be discharged safely. So it can still help with symptom management. So finally, the last slide I want to share with you is about advanced care planning. A lot of you have probably already heard about this and you know what it is, but just in case there is a group that's not quite aware of it, basically it's a process. It's a communication process between you, your family, and your healthcare team. And what we want to do is we want to get together and understand, think about your choices. If you don't know, learn, make a decision, talk to your doctors and record it. And that's what that is. And I don't want to belabor this, but just to give you that insight, And to encourage you, for those of you who haven't done that, should probably access this website. It's called speakup.ca. It's a very, very beautiful, very easy to use website. It's got lots of practical stuff like workbooks that you can adopt. And this is why it's important, because we want to make sure that wherever you're receiving care, it's always aligned to what you think is important, what you think is in alignment with your own values. And I want to end with these links. And like Shane told you before, this will be available for all of you at the website. So you don't have to worry about copying this. And with that, I think I'll just pass it back to Mark.
Many thanks, Dr. Kalluri and Dr. Shapira. Excellent presentation. So just a reminder, if you do have a question, please submit it using the Q&A feature on the control panel on your screen. And I'll leave these up. These are some helpful links that Sharon has kindly asked that we share while we do our Q&A. So I'll go to some of the pre-questions that came in advance, and I'll also go to some of the ones that are coming in right now. So the first one here is, I'm in the severe stage of IPF but feel fine. Once the self-isolation restrictions are lifted, will I still need to self-isolate until a vaccine is available? If not, what restrictions will I have to maintain?
So maybe I'll start with that one. Thank you very much, and thanks for that question. You know, I think like we're going to see for a lot of the questions that are going to be asked in the later parts of this talk, the answer is that we really don't know, you know, and I think, again, it's going to really depend on where you're living and what the status of the infection is at the time when you're asking the question. So as an example, if you live in a very rural setting that doesn't have any COVID-19 right now, when they start to loosen up, those people might feel pretty confident going out and living a life that is like their peers, not normal, but like their peers. On the other hand, if you live in a place like Montreal where the outbreak is still really active, but they're starting to loosen restrictions and opening up schools and things, many of our patients would appropriately choose to be a lot more cautious before they go out into the world. And so I think, again, there's no right answer, but everyone has to look at the situation around them and make a decision that seems right for them at that time.
Okay, that's great. Thank you very much, Dr. Shapira. Here's the next question. Do some patients who are immunosuppressed fare reasonably well with COVID?
So I was on call and had the opportunity to look after one of the ILD patients who was immunosuppressed and did have other comorbidities. And I'm actually pleased to report that that one person actually did quite well. But like I said, this is anecdotal experience, and I'm sure none of us actually has all the answers because there are no studies to date on just ILD patients and COVID. So I think the short answer is I think we'll have to wait until more data becomes available when we understand fully what type of pulmonary fibrosis patients were affected and who responded in what way. But what I can share is the few patients that I've seen did remarkably well and were actually discharged within a week.
Okay. Thank you, Dr. Kalluri. Next question here. My interstitial pulmonary fibrosis is caused by rheumatoid arthritis, and I receive rituximab infusions for this, so my immune system is affected. My question is there anything specific people like me can do to lower the risk of getting coronavirus? When restrictions are relaxed, will wearing a mask in public help, or is it just something one can do to make you feel more secure?
So that's a good question. And in fact, it's such a great question. You can see some of the content from that question was actually answered in our slides because we know that that's exactly the kind of thing that people are asking. But to just reiterate, you know, particularly some of our patients who are on these immune suppressing medicines like rituximab, medicines that lower your immune system, those patients, we do think that they are at a higher risk of getting sick if they get the infection. We don't think it specifically puts you at higher risk of getting COVID-19. It's just so that if you do get COVID-19, we think that you're likely to get sicker than other people. And so those people do have to take precautions. Now, unfortunately, there's no secret cure. There's no secret way that we've been holding back about how to prevent infection that we are only going to tell to those people. what we say is that the same recommendations we're making for everybody else, they should still do, but there's really no playing around. With people whose immune systems are really low, they want to make sure they're being cautious, washing their hands. But on the other hand, as Dr. Kaluri hinted at, we can't go too far. We can't obsess over it. We can't spend all day worrying that anything we touch, even in our own homes, is going to make us sick. We have to find that balance of how are we going to live with this infection if it's going to last many months and years. And we don't even know if there'll be a vaccine. And if there is, we don't know how well it's going to work and when it's going to be available. So I think we have to learn how to live in this time rather than worrying about the future.
Great. Thank you, Dr. Shapira. Here's a question that's just come in from our Q&A panel. Do you think that COVID-19 will lead to fibrotic lesions in healthy lungs?
Excellent question. This is something that we have all wondered about. And the answer is we don't know enough from the current infection. So we don't know how many of our COVID patients who have recovered have these lesions because we haven't had enough time to follow them, right? Because when we discharge these patients, we would have to bring them back, say, in 2 months or 3 months or 6 months to understand if they have symptoms, if their lung function is bad, if the CT chest shows any scarring. But if we have to look back at our previous experience with other SARS, so for example, the other pandemics that we had, whether it was MERS or SARS epidemic, we do know that there were a small percentage of patients who did have some scarring in their lungs. So if I remember right, it was about somewhere between 5 to 8% of patients who had the SARS infection did have some scarring in their lungs. But now that we know a lot more patients with COVID-19 will be looked after in the future by lung physicians, it is possible that the actual number of patients with scars will be larger, but we don't know the answer. And I think only time will tell, which is why I think a lot of us are making sure that we are opening our clinics and keeping those spots open for people who would like to come in and be assessed and find out if there's scarring or not.
Mm-hmm. Okay, thank you, Dr. Kaluri. Lots of questions about vaccination. If a vaccine does become available for COVID-19, should we get vaccinated? Was the next question that seems to be percolating up.
I think the question is difficult to answer because the truth is that it's difficult for us to plan for what we're going to do next weekend, the weekend after that. I think about whether or not in a year, maybe longer, when these vaccines do become available, should our patients get them and should they get the first one or should they wait and see? I think we have to wait and see before we know what we can recommend. But what I will tell you is that in general, we think that vaccinations have been the single most beneficial thing to human health in all of history. There is no other medical intervention that has saved more lives than vaccines. So if we are able to get a good quality vaccine that has been shown to be safe and effective, there is no doubt that our patients should get it. The question is, there may be no vaccines, there may be several vaccines that all come to market at the same time, and which one do you get? Well, those are questions that we'll have to answer at the fall session. So I look forward to doing that session.
Perfect. Thank you, Dr. Shapira.
As I always say, whenever I do our local support groups and whenever I do these things, we're not going to make specific recommendations to any one person about their treatment today because that's for you to discuss with your doctor. But I think broad questions about, immunosuppressive drugs, antifibrotic drugs, and what effect they have specifically during COVID-19, those are reasonable things that we can hopefully try and provide some answers.
Sure. Okay, here's a couple of ones I'll just select. Might Esbriet or Bosentan be effective in alleviating symptoms or slowing deterioration of COVID-19 patients?
So both of these drugs work over time, slowly. And the way they work is by slowing down processes in your body that are causing your lungs to scar. Okay, so they're if you want to think about them, they're like anti-scarring drugs. They slow down the scarring. What happens with COVID-19 and when you start to get symptoms, especially in the early phase, is because you have a viral infection. And at some point, your immune system, it takes over your body too much, then you start to have reactions from that immune system directly, the ravages of the immune system. So neither one of these drugs will directly be able to act on the virus to suppress the viral load down, so it won't affect the symptoms that are coming from the virus. And they also don't work on those immune pathways that are being revved up by this virus directly. So they won't affect symptoms that are coming from that immune system attack, so to speak. So in the initial phases, whether it's the virus doing it or whether it's the immune system doing it, neither one of these drugs works on this pathway that we know of today. So I don't think these drugs will act really quickly. Where I think most of us are interested in is if these people who are recovering from the virus now have scarring in their lungs, can these drugs then affect the scarring that has developed as a result of recovering from the virus? That's a different question, and we don't really know the answer to that. But the short answer is, in the short term, your symptoms from COVID-19 will not be directly treated by these drugs.
That's great. I think maybe the last question we'll take, just in the interest of time, and one that seems to percolate through from a few individuals, is with respect to international travel. A lot of people asking if they should avoid that and avoid traveling, essentially.
Yeah, I think the answer is, Disney in Shanghai just opened this morning. I think probably most of you should take a pass and wait until Disney opens up closer to home. I think we don't know what'll happen in the future, and it really depends if this virus kind of fizzles out or if it stays active and live for a long time. It also will depend regionally. If you live in a place that has lots of COVID-19 and you're planning to go to another place that has lots of COVID-19 for the winter, if you have access to medical care, if you got sick in that place, there's no particular reason to believe why living in a different city while practicing the same physical distancing would be different. On the other hand, if you lived in a place that had a low rate of COVID-19, it seems to me like it would be unwise for you to get on an airplane and travel to a place that has lots of COVID-19. And I will tell you, there's now 1 million cases of COVID-19 south of the border. There are tons of cases of COVID-19 in Europe. Canada, although we do have to deal with this infection, and we've unfortunately got lots of sick people, on the whole, around the world, we've actually done very well. So I would say, if it was up to me, I would enjoy our free healthcare, our low levels of COVID-19, our beautiful, serene outdoors all over the place where you can see beautiful sights and go on long hikes by yourself or with your close loved ones. And I'd probably save the Disneyland for the kids.
Perfect. Thanks very much, Dr. Shapira. Sharon, we're at the end of the webinar. Any final thoughts or comments that you'd like to leave the group with?
Yes, I just want to reassure everyone that all the links from Dr. Shapira, Dr. Kaluri, I will have them and put them on the CPFF website, hopefully by the end of today, but for tomorrow for sure. And again, I want to thank both of them and also to Boehringer Ingelheim Canada for supporting this webinar, and thank you. And I know there's a couple of people who also asked about online support. Just know that if you sign up for CPFF's newsletter, we'll tell you about how we're rolling that out.
Wonderful. Sharon, thank you very much for the opportunity to support you and the CPFF with this webinar. And thank you. Always a pleasure working with you, Dr. Shapira and Dr. Kaluri. Thank you for the excellent and informative webinar, and for your time and expertise. Stay well, stay safe, everyone.
Thanks, everybody. Stay safe.